Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness Podcast with me, your host, Dr. Deborah Durst. So today I have a couple guests with me. Marissa Staten, who you may have met a couple times and may even have heard in the past. But then I also have a new guest with me, Brooke. Brooke is new to RevitalyzeMD, and so it gives her an opportunity to introduce herself. And then also she has some questions on some frequent treatments we do, and we're going to talk about threads today. So Marissa, do you want to say a couple words?
Yes, hello. I'm glad you guys are listening today. Welcome. Today we're going to talk about threads and think about what questions you have about threads and see if we answer them for you.
Awesome.
I have a ton of questions. Okay. I would like to just start by saying, what is a thread lift?
No. First, you have to introduce yourself a little bit. They are going to get to know you over time. So just what your name is and what you're doing with Revitalize.
Hi, guys. I'm Brooke. I'm the new patient coordinator at Revitalize. I am a week in and have learned a lot, but also have so much to learn.
I guess I didn't warn her that she was going to have to introduce herself, or I could have done it for her, but that's okay. We like the impromptu aspect of it. So you have lots of questions. And again, we do threads very often on a daily basis. And so Brooke is going to be answering lots of questions on the phone and actually also prepping patients for the treatment and giving them post instructions. So we're going to let her ask some questions and get used to the answers and familiar with the thread treatments. So go ahead, fire away.
Will you just explain what a thread lift is, please?
All right. So I'm sure that a lot of people have heard a little bit about threads. And so again, it's kind of referred to different ways. Maybe a thread lift, maybe PDO threads, maybe a thread facelift. It's called all kinds of different things. But so threads are suture material. So it truly is almost what it sounds like. And they were used for surgery. And then they realized that they had all these great skin effects and the skin over the surgical sites looked awesome. So we started using them back in the 90s to do different things. And so what we do now is we place those sutures underneath the skin in some way. There's different types of them, and then it can stimulate collagen and elastin, and also some of the threads have barbs or molded barbs, and so you can actually lift tissue with it too. So that's why it'll be called like a brow lift or a facelift, a thread facelift, or even a thread neck lift. So all kinds of different terms. But does that answer that question? They're actually sutures we place underneath the skin to have beautiful effects on the skin.
Yeah. So is a PDO lift the same thing as a thread lift or PDO thread?
Yeah. There's lots of different thread materials. And so we do use PDOs, and those are the most commonly used threads. And so that's polydiaxanone. And so that's the thread that we use. And then there are other threads such as PLLA, which is one. And in a ground up form, that's actually Sculptra, which you can inject. But there's actually threads that are like that too. And we don't use that in the office. We use all PDO threads right now. And then there's PCL, there's PLGA, all kinds of different ones. But the one that you'll need to know is PDO. Those are the ones that we use. Those are the most frequently used ones. They have great results. And then there's all kinds of different types of PDO threads. So when they say threads for us and they say thread lift, they want threads done. It's all the PDO threads. Mm-hmm.
Awesome. So what areas can you lift?
That's a good question. Marissa, can you think of one special area?
Believe it or not, you can do the nose.
Yes. We're going to talk about different areas in different videos, but you can actually, create a beautiful nose lift just with a thread. And sometimes that is safer than actually using filler in the nose. And actually, I would almost venture to say it's always safer. Whether it's going to be effective or give you the results is a whole nother issue. But you can do a brow lift. So you can actually use it. It's the only non-surgical way to do a brow lift. I mean, you can do some resurfacing. You can do lasers that tighten and lift in the eye and around the eye, and it'll lift. You can actually put a little filler underneath the brow. You can do all kinds of various things to lift and make the eye more open. You can even use Botox for a lift, but nothing will give you the results that a thread will give you without surgery. And then you can do a whole face. So what's the big concern areas on the face that get heavy over time?
The cheeks. A lot of people are concerned about the cheeks and the jowls.
Yeah, exactly. Those two areas, the nasolabial folds and then the marionette lines are the jowling. Those are the two big areas. So we can bring the thread all the way from the cheekbone down across the nasolabial fold, or grab onto the lower cheek in that heavy fat pad right by the nasolabial fold and pull back, or right around the jaw, and pull back on that jowl and create a sharper. I love when you do that, because then it's just guiding what I'm saying, pointing out those areas. Exactly. So it can create a sharper jawline. And then you can actually do neck, where we'll go underneath the mandible and the jaw and lift up again to create a sharper jawline. You can put it above and below the mandible or jaw to get a sharper jawline. You can actually even add filler back, in the mandible to, even more define the angle of the mandible back there. So there's all kinds of things. And then you can actually put them in smooth. And in fact, you can put them anywhere. You can put them in the décolleté. You can put them in the neck. They're not often lifting then. We're doing smooths or twisted, which just stimulate collagen elastin, but they're awesome for stimulating collagen elastin, thickening the skin, smoothing out those lines. You can put it in the back of the arms, above the knees, behind the arms, anywhere, in the breast. You can almost put them anywhere.
Is there anywhere you can't?
Well, I mean, no, but there's probably a couple places
Yeah.
I haven't. I don't think that you could probably put them, just about any. You can put them in the butt for,
Sure.
You can put them in the butt for a butt lift, and then again, we've had breast where we'll do the vampire breast lift, and then, have wanted threads in the breast. You can put them in scar tissue, acne scars, stretch marks. So no, there's not too many places you can't put them. And the nice thing about it is, it's a thread. So it's going to be underneath the skin, stimulate collagen elastin, but it's not going to occlude a vessel like you might have happen with filler, because filler is very thick. So if it goes into a vessel, it can cause issues. So that's just another beautiful way to regenerate skin and lift.
So there's the twists, the barbs, the smooths, and other types. And you just choose which one you need for the area and the why.
Yeah.
So the barbs are going to create more collagen, elastin, and actually hold the tissue better.
And
could you elaborate more on that?
Yeah. So you actually broke them down perfectly. There's a smooth. And so that smooth is not going to do anything immediately. They're smaller, and so not as long. And you're going to place them underneath the skin to get stimulation of collagen and elastin. And then the next step out is a twist thread. It can be called a cog. Even the smooth can be called a mono. They're called, or a sugar. You hear sugar on, the Netflix show. Those are all smooth threads that stimulate collagen and elastin. So you can use them with the lifting threads as well. But the twist is the next one, and that can be called a cog as well. But we use twist, and that's going to stimulate a little bit of collagen and a little more collagen elastin than the smooth, but it's also going to pop it out. So you'll get some immediate effects and then build collagen and elastin. And with the smooth, you don't get anything immediate, but you get great long-term effects. And then the actual barb or molded are going to lift. So you have the thread that'll stimulate collagen and elastin, but you have barbs on the thread or molds on the thread that actually lift tissue. And so it stimulates collagen and elastin like the other two, but you're going to get that immediate effect and you're going to get lifting. And so frequently, even we pair, the lifting threads with some laser, or Morpheus or radiofrequency microneedling, just because if we need a lift at all, if we need any lifting in tissue, and I don't think anybody over 40 can't use lift in their face, neck, other areas, then we want to pair it with something that actually is going to do a little regeneration and lifting and building collagen and elastin, so it takes some of the tension off the lifting thread. So we'll use them in combination with amazing results. So, but yeah, those are the different types of threads for the most part. And then again, even in the nose, we'll use a lifting thread, which you wouldn't necessarily think you need, because you're not pulling up on it to lift, but you're putting it underneath the muscle and deep. And so it's going to lift up the tissue, build collagen and elastin, but it gives you that immediate effect of lift. So
it's more like a filler or filling.
Yeah. Well, actually the whole concept of threads is it's a solid filler.
Okay.
So basically you're not using, so the difference between fillers and threads is really that you are using a solid substance to fill. and you're using liquid with filler. But the advantage of threads as a solid filler is that you get stimulation of collagen and elastin, and you do not get that with HA fillers. You do get it with a biostimulatory filler such as Radiesse. But other than that, you're not going to get any stimulation of collagen, elastin, no regeneration with filler alone, although people need volume replacement. But this actually acts as a solid filler, so you get stimulation of collagen, elastin, and you get the lift. So yeah, and it doesn't impede movement. It's less risky. I mean, you have to be in the right hands, and it has to be a skilled provider doing it. You know, there's large vessels they can enter that are a problem, but it's not going to occlude like a filler may. Yeah.
I'm so interested, but how painful is this?
So have you watched any of the videos at all?
Yes, I've seen one or two.
Yeah. So we actually will put a bunch of boomerangs on too, which it almost looks like somebody's like stabbing them in the face or stabbing them in the neck. Yeah.
And the lifting motion, I'm like, does that feel good?
Yeah. And the lifting motion too, those boomerangs where you have them in and then you're lifting and really we're just pulling up on them as we're cutting them. And so we're lifting and you can see that. And then we can also do the smooth ones. So we're actually just taking them out. You do boomerang, but it looks like you're stabbing them in the neck. But so that actually looks worse than it is. But honestly, even with those, it's just that people like to see that and we have fun doing them. But threads are actually very comfortable. They're quite addictive overall. I don't know that there's even a woman that I have treated so far that hasn't wanted more, you know, or at least, you know, there might be one or two, you know, that at least not wanted more. But I'm not sure that they haven't wanted more. They just haven't been back yet. Yeah. But basically, they're addictive, you know, that women tend to want more and more of them. And so that alone would say they're not painful, but really they're quite comfortable. Like it looks worse than it is. And so when we do the videos, you know, again, we're kind of numbing them at the surface where we go in and we numb the track and they do quite comfortable. And then actually maybe even Marissa can talk a little bit. And at some point we'll do videos and some podcasts on the specific areas of treatment. But Marissa had do you want to share?
The nose lift?
The nose lift, yeah.
Yeah, it was not painful. It was not painful at all. And it was very quick. And I would do it again. Yeah. And it works immediately.
She's one that is addicted.
She's one that's addicted. Yes, correct.
Absolutely.
Absolutely.
And that's the only place I've done so far, but I want everything now.
Yeah.
Did we say arms?
Yeah, exactly. Well, and above the knees, I think, even with the laser and skin tightenings and like the tight sculpting that we do, you know, the Body FX, above the knees, actually adding threads, lifting, and then getting stimulation of collagen elastin is another great area for women to get threads done, because it's another area that's going to just diffusely cause problems with women as we age. And again, the body composition changes. And has heard all about that and actually seen it because she has done training and will continue to do some of that. Maybe she'll get all of our office in shape too, or at least
we can do group classes,
or at least make us feel, you know, guilt us into it, right?
That's right.
Make us do squats during the day.
Lunchtime.
Listen, I know you have those threads, but if you just did some squats, your thighs might look better.
They start throwing pins at us.
I know, exactly.
Pick that up.
Yeah, correct. That's
it's
true.
amazing.
How to trick us into it, but no. But and Marissa had trauma to her nose before, so that was the main reason why she couldn't. I mean, you can do filler, but you have to be very cautious when somebody's had trauma or previous surgery because the anatomy is not the same, and so their blood supply is different. And so if you do filler, you can actually, you know, cause issues, and that's a huge vascular area. And so you can cause problems with vision. You know, if you are not in the right hands with any filler in the temple, under your eyes, or on top of the nose, it can be bad news if it goes wrong.
Your nose looks amazing.
Thank you.
No,
I guess I should elaborate on the trauma I had to my nose. I actually, I believe it was the end of my junior year in high school. And I had a car accident and my face actually went through a windshield. Very lucky to be here. But it did break my nose. I survived, obviously, with limited trauma. I mean, other than breaking my nose and some scars were, you know, from cuts from the glass. But anyway, as I age, you can tell more and more, or you were able to tell more and more with my nose that it was had been broken and wasn't straight at the end. And anyway, it was something that was really beginning to bother me. And I just wanted to look like it did before.
Well, she was ready to go with it for sure. And it looked amazing. And we can talk, we'll put a video up of like even the treatment. She did a great job. And so that wasn't painful. And I would think of all that would be a more painful area.
Sensitive.
Yeah. And the brow, there's not a lot of subcutaneous tissue up there, but they do great with brows and face. I mean, I probably the smooths, if not left with topical long enough, is probably the most uncomfortable. And that's, can be solved, that problem. They just need to sit for a little longer with the topical.
When did you have that done?
3 weeks ago, maybe a month ago.
Yeah.
So do you see results like instantly?
And I didn't even bruise.
Swelling,
not even
nothing?
a little bit.
So cool.
Just sore.
Yeah.
But that was it.
So do you leave the thread? I heard you say cutting the thread. Do you like lift and then cut it and leave the thread under the skin?
Yeah, you basically are pulling up, getting a lot of lift when you're placing it. You get more lift when you're actually getting ready to cut it. And then you actually, just pull it a little tight. And so that the skin is kind of wrinkled. And then once you cut it, then you leave the thread in place and it dissolves over the next 6 months, and then the collagen, elastin stimulation could be up to 2 years, but usually you're replacing threads about 12 months if they're not back earlier for other ones. And smooths you do more frequently because, again, they're addictive and patients, I wanted to say women, but it's women and men, and patients just want more.
How long did you say that usually takes? I'm sure every area is different, but
about approximately an hour.
That's not too bad.
So it could be your in office, no downtime, lunchtime procedure if you really wanted it to.
Yeah.
And you can go back to work so you can get your non-surgical brow lift and elevated. And again, you can always put more threads, with additional treatments if you wanted it even lifted more just to open up those eyes. You can do cat eyes, which are like more of like a Hollywood kind of, new trend where you bring the angle up just a little bit more subtly. Yeah, you can do all kinds. You can put them in the nasolabial fold. So if we're doing a cheek treatment, we'll do it more comprehensively and we can put a thread to lift with the cheeks, which look amazing. Or you can put in a twist thread or two in the nasolabial folds that help pop it out because you don't want to do filler there unless you absolutely have to. And we actually don't do it that often in the nasolabial fold because again, that is not, we're filling there, but that's not what we need to do. We need to lift back on the cheek to take the pressure off of that cheek on the nasolabial fold. So it's a more natural way to give volume and lift back.
So are there many complications with this and risks?
Yeah, it's good questions, Brooke. And now you'll be all prepared, right? Yeah. So basically, there's always a risk anytime we do anything. So if we're doing putting a needle and skin anywhere, there's always a risk.
Right.
So, and there's always potential complications. Most people do really well with it, but there's always that risk. And so again, skilled, knowing what type of threads, knowing which thread companies, FDA approved companies with the right threads and PDOs are safe and very effective. And then knowing how many threads, how to place them, and you're at the right plane and depth. That's the big key. So if you're not in the right plane and the right depth and you're not experienced at placing it, that's probably when the most complications will happen. You can go into deeper structures where you don't want to be, like the parotid. If you're doing a facelift with threads, you can actually go into the muscle up in the forehead and the brow lift, but you can also just get it where it's too superficial and you get some buckling. Yeah. So most of the time the buckling is actually from like the barb catching the tissue and eventually it'll let loose. So the things people need to be aware of is you're going to feel some tightness, right? So like it's going to feel like something's pulling and that should happen, because the barb will grab onto the tissue. So you'll feel tight for 2 weeks at least, no exaggerated, expressions and movements and just to let it set. And then if you ever feel like kind of a give suddenly, that's normal too, because then it finally has loosened and settled. Yeah. And then, but it's going to work its magic. And most of the time, if anybody has any nodularity, really, if it's in the right depth and placed, by a skilled provider, you're usually just massaging it for the first 2 weeks at home. If it lasts beyond that, sometimes we may need to, do a forma, radio frequency, like kind of heating, or put a needle underneath the skin and kind of just loosen up that barb and whatever it's caught onto. But very infrequently do you have a barb, but it is potential that they could actually come to the surface. You need to remove them, or the buckling doesn't go away and you need to remove it. So, you need to make sure that whoever you're going to, again, is experienced also in treating complications if it happens.
Right.
So, but yeah, of course, everything's a little risky, and it sounds worse than it is. It looks worse than it is. But ladies and gentlemen patients do very well with it.
Yeah.
They actually are very comfortable. You've seen quite a few of them placed, and you have to come in the room. And now that you've had all the questions answered, now you need to come in and actually watch
I'm
some
so
of them
interested.
done. Yeah.
I'm in.
Yeah.
It's awesome.
And even the young girls now are wanting them. They want them too to lift. And that's actually a great starting point. So if you're looking at a video thinking, and she's laying back a little bit too, thinking, why is she having that done? That's actually probably when you need to have that done, just so you never have that collagen, elastin, and laxity that happens in your face, and you have that lift all the time. So
what's the earliest you think is like okay to have this done,
Yeah,
age-wise?
I'm definitely over 18. We won't do anything out there. I know the trend might be to, moving things.
When you notice something that's
allowing a droop,
drooping a bit.
Yeah. Okay.
If it's drooping, or, where I see younger patients doing it is, again, sometimes just genetically, they don't have that jaw definition. And even if you have like a double neck, or turkey neck, whatever you want to call it, double chin, double or triple chin. Sometimes that can be genetics, and we've had like weight gains and losses during, adolescence. Even putting smooth under there and doing a lifting thread is quite nice. But I find that younger want more definition of their jawline. So maybe some filler at the angle of the jaw that defines it, and some lifting and some smooth threads right underneath the chin. Really tighten and define well.
Awesome. So I think you already answered this question. My last question is just, where's your favorite area to lift?
Yeah.
I think you're a big fan of the nose.
I love the nose. Okay. Yeah. I love the nose.
I thought so.
Yeah. It's just, I wouldn't have thought about doing it until I heard about it for the first time, which was probably a year ago. And we actually spent a lot of time just trying to figure out which thread. And sometimes I have trouble getting Marissa on. She's always busy doing treatments on others.
I've noticed
and
already.
Sometimes if she fears it's going to be a little painful, she'll like hide from me for a couple weeks, and I really have to I'm busy. I'm doing anything but that, but she was ready for this because we had searched for the right threads for a while. And so we had specific nose threads, and it was beautiful. Very, very easy to do. I love the results. Yeah. And just the fact that you can do that without filler, if somebody just wants to lift up on their nose and thin it out. But with her, just that little flattening from a previous trauma, and it lifted beautifully.
Yeah. I would have never guessed you've had trauma on your nose.
Yeah. We do the faces and the under the jaw the most frequent, and brow. And then we put smooths everywhere. So we'll do those frequently too. So yeah.
Incredible. You've answered all my questions. I can't wait to see it now.
Good. So then when they call, now you know how to answer it and get them in for their treatments. But yeah, we have patients that come from far distances because they're not doing them a lot of places, but it's an amazing treatment. And to pair with other things like our laser for lifting and tightening and, and then you put some threads in too. And then of course, if they have volume loss, if you do cheeks, you do some threads in the face, and then you do some laser for thickening the skin. It's just amazing overall. The change, the transformation in a face with it. So, I have
one last question. I know we're talking about areas and the different areas that you can do, but we didn't mention lips, because I know we usually use lip filler for that, or lip lace from Photona. Can you do lips, or is it more of the vermilion border?
Yeah, so you can. So we did forget an area, and I'm glad you brought it up, because it's the twist that you would use in the lip, in the vermilion border. So right at the border of the lip, between the red and the pink lip, you're going to put twist threads. You can put up to 5 where it just pops it out. So that's a great question, because if somebody doesn't want filler potentially in the lips, then they can get threads. And then, there's different ways to plump threads, and we'll do like or plump lips, even without filler. And there's, and we can talk about that on another, video and podcast, but twist is one of those many ways that you don't have to use filler. So if people are afraid of filler, this is another great way to do it.
That's huge.
It is huge. And the other big thing that we do is, again, a lot of smooths in different areas. So even if we're doing lifting threads for the face, we can put crosshatch, 10 smooths in a different area, on the cheek, the lateral aspect of the mouth, up higher on the cheek, just to get more lift and to get rid of the fine lines and wrinkles, scratches, dents, all that. And neck. For the crimpy neck is another good area of treatment for smooths, and it tends to be kind of over and over again. And then the décolleté as well. Great area. So brow, above the brow, put a little Botox in there, do brow lift with the lifting, and then put some smooths above there. It does a nice lift.
So they do it all.
Yeah.
They go everywhere.
Yeah. We love threads. Can you tell we love threads?
Yes.
I think you love them by the end too.
Yeah.
So you're just too young for them, right?
Sure.
All right. Well, good. Well, I'm glad you were on, Brooke. So this is Brooke's first time on.
Yay.
And so you'll get to know her. And if you are coming to our office or calling our office, you'll get to know her on that too.
You can say, give me those threads.
Give me those threads. Call the office.
Gotcha.
So,
hey, Brooke, I need to talk to Brooke about those threads.
Yeah.
That's right. And then Marissa, thank you for being here as well. So I'm glad we got to answer some questions about threads. So if you have any other questions that you would like answered, please leave it in the comment section. Or if you've had experience with threads you want to share, please share this video with others so that we can actually get the information out to more people. And then also like and subscribe and hit the bell. So again, thanks for following along, and we're here to revitalize your look, your health, and your sex life. Thank you.